Hello and welcome. My name is Dr. Nelly Bosire and I'm a gynecologist, and today we shall be talking about contraceptives. So what are contraceptives? A contraceptive is any means that helps to prevent pregnancy from taking place. In Kenya today, we know only about 46% of our women have access to contraceptive, and leaving about 54% of women out, that's quite a number that we need to be looking at. That's the reason why today we shall be talking about one of the commonest contraceptives used in this country, and that is depo-medroxyprogesterone acetate, commonly known as Depo-Provera. Depo-Provera is an injection contraceptive, and it's usually given to women and it works for a period of about 12 to 14 weeks. Therefore, the injection is repeated every 12 weeks, and it's about 99% effective with only less than 1% failure rate. For the first time lady who's going to a gynecologist looking for a contraceptive, then what are the things your doctor needs to know if you think this is a choice for you? First of all, you need to let your doctor know if you're taking any medication for conditions that may interfere with the effect of the function of this contraceptive. And top on the list, we'll be looking at epilepsy, mental illnesses, any fungal infections that require you to take oral tablets, HIV, and patients who are also on treatment for tuberculosis and what we call Cushing's disease. For those who are completely not recommended for use of these contraceptives, these include patients who have liver disease, breast cancer, deep vein thrombosis, or unexplained vaginal bleeding for which we do not have a diagnosis yet. It's also a contraceptive that we use with caution among the teenagers and for women who have a risk for osteoporosis or who may actually have been diagnosed with osteoporosis. So what are the benefits? What makes this a very palatable contraceptive? First of all, it's very private. That means that nobody has to know that this is what you're using for contraception. It's also safe in breastfeeding, and it doesn't require any daily dosing, so you do not have to remember. And it also has been shown to protect against cancer of the endometrium, which is a cancer of older women but can be quite devastating. So what are the common side effects? The most common, irregular bleeding. The menses become irregular. They may be very heavy sometimes, but usually within 6 to 12 months they will reduce and become very light. And for more than half of the women, after about 1 year of continued use, they will actually disappear completely. There'll be a change in the sex drive. This differs from woman to woman. Some women may actually have increased libido, others may have decreased libido. A lot of women will complain of headaches, especially within the first few months, accompanied with nausea and sometimes soreness of the breast. But these are transitory kind of side effects, and they generally tend to settle down with time. The most commonly asked question is weight changes. And yes, Depo-Provera does cause weight changes, and this differs from woman to woman. Some women may actually have increased weight, others may have decreased weight. It's not equal for everybody. And also for people who fear needles and injections, the point of administration may be a bit uncomfortable. So Depo-Provera is generally a safe contraceptive to use for a vast majority of women. But if you're on it, your most important lookout signs for that will make you go back to your doctor is if you're developing jaundice, which is yellowing of the eyes, of the skin, if your periods become very heavy and very prolonged, that you're generally getting to a risk of anemia, or if you notice a new breast lump, you do have to have that checked out with immediate effect. So, do you think this is a contraceptive for you? Look out for us next week again as we discuss further options. Eventually, every woman should find what works for them. Thank you very much.